This event is called to order. I am Ms. Jacqueline Bryan Niles, Acting Permanent Secretary in the Ministry of Health, and I am your chairperson for today's launch. It was Raf Kavuklan who said, and I quote, "If we change the beginning of the story, we change the whole story." I repeat, if we change the beginning of the story, we change the whole story. Honorable Premier, Minister of Finance and Health, Dr. Ellis Lorenzo Webster. Honorable Minister of Home Affairs, Lands and Physical Planning, Mr. Kenneth Hodge. Honorable Minister of Infrastructure, Communications, Utilities, Housing and Tourism, Mr. Hayden Hughes. Honorable Minister of Social Development and Education, Ms. Deanne Kentish Rogers. Honorable elected member and parliamentary secretary, Mr. Merrick Richardson. Other ministerial appointees, Chief Medical Officer, Dr. Aisha Andrewen. Health Services Commissioner, Ms. Leanne Salinde. Medical staff, public officers, media houses, parents, guardians, teachers, boys and girls, other invited guests, persons listening via social media, a pleasant good morning to all and a warm welcome to this morning's proceedings. A bit of housekeeping before we get moving. All cell phones, please be turned off or put in silent mode. Thank you. So before we begin our presentations this morning, let us invite the presence of God in our midst. At this time, I would ask Apostle Denroy Gums to lead us in prayer.
A pleasant good morning, ladies and gentlemen. Let's stand as we pray. To the Supreme Spirit of the universe, creator of everything that exists, we thank you this morning for giving us the breath of life, energy, and strength. We thank you for every blessing and benefit this day. We acknowledge that it is by you that we are able to function as we ought. Today, Lord, we are grateful for the opportunity to celebrate the launch of Junior Shield. Thank you for all the necessary parties involved that made this incredible initiative a reality. Continue to guide and protect the visionaries, the government of Anguilla, and the people of Anguilla. Guide our minds this morning and our tongues, and let the proceedings of this meeting go according to plan. In Yeshua's name I pray. Amen.
Amen. Amen. Thank you.
Thank you, Apostle, for your blessings. We are here this morning to witness yet another milestone in improving quality of health care on Anguilla, making it affordable and easily accessible to all. In March 2023, the government of Anguilla and the Ministry of Health introduced Senior Shield, which focused on free health care for the elderly 70 years and older. Today, we begin the rollout of our Junior Shield program, which covers 4 groups. You will hear more about the other groups later on in the program from the Minister of Health. The government of Anguilla understood the message behind the words of Raf Kavuklan and what it meant for Anguilla. If we change the beginning of the story, we change the whole story. Therefore, the first group to benefit from this medical subsidy program is our children aged 0 to 5 years old. The long-term goal of the Ministry of Health is to focus on primary and preventative health care. And the best point to start changing our story is to start by caring and shaping the lifestyles of the most vulnerable groups, our newborns, infants, and young children as they grow and develop to adulthood. Therefore, this initiative underscores the government of Anguilla's commitment to improving child health outcomes and reducing financial barriers to medical care. Nurturing children is not just a parent's job. We understand the need to work together to ensure that parent, the nurse, the pediatrician, teacher, and policymakers are all empowered to provide a holistic, nurturing environment for our children, shaping their lives to change the whole story and build a healthy nation. This is clearly demonstrated by your presence in this room today. And on that note, I will call on representatives from our service provider, the Department of Health Services, to make two presentations. Firstly, I will invite the Health Services Commissioner, Ms. Leanne Salende, who is the head of the department, to give brief remarks. Please welcome Ms. Salende.
Okay, ladies and gentlemen, good morning. I am honored to be with you today at the launch of the Junior Shield program, an initiative dedicated to providing comprehensive care and treatment for our youngest citizens. Aged 0 to 5 years. This is an important step toward ensuring a healthier future for our children and, by extension, for our communities. In preparation for the Junior Shield program, the Department of Health Services reinforced its pediatric services by recruiting a second pediatrician to join our dedicated team. This addition will enhance our capacity to provide personalized and timely care, ensuring that every child receives the attention they deserve. Moreover, we are harnessing the power of technology to improve our healthcare delivery. By utilizing our electronic medical record system, we are ensuring that patient health records are always accessible and available to our healthcare team. This seamless connectivity allows us to make informed decisions and respond swiftly to the needs of our children, ultimately delivering a higher standard of care. We know that the early years of a child's life are critical for their physical, emotional, and developmental health. Junior Shield will focus on regular health checkups, nutrition education, vaccinations, and early interventional services for developmental concerns. By addressing health issues early on and equipping parents with the necessary resources, we can alleviate potential long-term challenges and enable our children to thrive. I encourage all parents and caregivers to not only take advantage of this program, but also to register their child for Junior Shield. This registration will ensure seamless service when you visit our hospital or polyclinics, allowing us to deliver the best possible care efficiently. Together, let us invest in our children's health, ensuring they grow into healthy, happy, and productive individuals. Thank you for joining us in this vital initiative. Together, let us build a brighter, healthier future for our children. Thank you.
Thank you, Ms. Salandi. And now I call on Public Health Nurse, Expanded Program and Immunization Manager, Mrs. Faye Astafan, to give brief remarks. Let us welcome Ms. Faye Astafan.
It's a long clap. Good morning, everybody. If you don't know me, my name is Faye Thomas Astafan. I am the manager of the Expanded Program of Immunization here in Anguilla, and I'm also the district nurse manager of the Welch's Polyclinic. I am very thankful to be here this morning. It's a great opportunity to speak on the introduction of the Junior Shield. I consider this to be a very important opportunity for children and for parents of Anguilla to embark on a journey of lifelong good health. 0 to 5 years is a critical stage for the child's growth and development. This period is where the foundation for physical, mental, and social health is laid. Our health system offers many opportunities for parents to work with the health team to ensure that their children are given the best opportunities to do well. Within 48 hours of discharge from hospital, a new mother expects to have a visit with her midwife. The initial visit is geared to ensure mother and child are adjusting well. Within that week, that child will be seen by a pediatrician. These visits can be done sooner based on condition of the child on discharge or any assessed need after discharge. You can assist us. I'm begging all the new mothers, please, if you have not seen your midwife within 48 hours, give us a call, we will come, okay? Child health clinics are also scheduled weekly at all 3 of the polyclinics. Children should be seen at least once per month up until that child is about 7 months. Then visits subsequently will be done based on assessed needs and on our preset schedule. This will continue until the child is about 5 years of age. The clinics are not just for vaccinations. These clinics allow for child's growth and development to be monitored and for us to be able to identify any issues early enough so that we can do any intervention needed to reduce any ill effect on the child. Speaking about vaccinations are also offered during the child health clinics. We offer up to 14 vaccines against childhood preventable diseases, including measles and polio. And if you're listening to the news, you know these diseases are on the rise again, and I encourage parents to please immunize your children. We also offer access to laboratory and radiography assessments. So the nurse-led clinics at the polyclinics and the pediatric clinics up to 6 weeks were previously free. With the introduction of Junior Shield, all services for children 0 to 5 at the Princess Alexandra Hospital and at the 3 polyclinics are now free of cost. I encourage parents to take advantage of this opportunity. Take advantage of these services. These are opportunities to ensure that your child is given the best opportunity to do well, to have a healthy future. We also encourage parents, please keep your appointments. We make appointments for a reason. These appointments are designed at the optimal point in your child's growth and development so that we can monitor the milestones, monitor any issues that we expect to occur around that age. Please keep your appointments that your doctor and your nurse gives you. So, a healthy, well-developed child will become a healthy, well-developed adult, able to contribute to the growth and development of this country. At this point, I would like to applaud the government for making this investment, because it is an investment into our future. But we can only do this and make this a success if we all take part and do our part. Thank you.
Thank you, Nurse Faye, for a very informative presentation and certainly for encouraging parents and guardians to take advantage of the Junior Shield program. At this time, I would like to acknowledge the presence of the Honorable Quincia Mary for joining us, and the little one, welcome. And you can already tell that our children are pretty much excited about the program because you can hear them in the background. So let us applaud them as well for keeping us in tune and knowing the purpose of why we are here. So they too are celebrating. So we have heard from our service provider, and now it is time to hear from someone who uses these services. Help me to welcome a parent, Miss Rihanna Stott, as she comes to the microphone to share her testimony about our services. This is what parenting is all about.
Yes, please. Okay. Good morning, everyone. My name is Rihanna Stott. I am honored to be here this morning to present a parent testimony on the Junior Shield. I am a first-time mom and parent to a 1-year-old boy. When the Junior Shield Comprehensive Healthcare Access was announced, I saw it as a great opportunity for residents in Anguilla with young children, as a healthy person lives a longer and healthy life. As Jim Rohn said, take care of your body. It's the only place you have to live. One healthy child can inspire many others who are trying to get better, feel better. It is my duty as a parent to ensure that my child is happy and healthy. With this Junior Shield, you can give your child or children the opportunity to receive regular medical checkups to become or remain happy, healthy little human beings. Everyone should know all too well that health is wealth. I strongly recommend registering your child or children for the Junior Shield to ensure that they can receive medical attention from any public facility at no cost. If you're scared or feeling embarrassed when it is time to present your card at the cashier, please remember who is benefiting from you registering. I signed up my son for the Junior Shield to be able to give him the freedom to have medical care. It is your responsibility to make sure that your child is physically and mentally healthy. Remember, it costs money to stay healthy, but it is expensive to get sick. Don't forget, you the parent must try to stay healthy too. As a happy, healthy parent, make a happy, healthy child. I would like to thank the government of Anguilla for implementing this valuable benefit for the youth in Anguilla. I would also like to thank the staff at the Ministry of Health and Social Development, National Chronic Illness Unit, for reaching out to me and giving me this opportunity to share a parent testimony on the Junior Shield. Do enjoy the rest of the program. Thank you.
Thank you, Rihanna. And I am sure there are other parents, many more, present or listening via social media who can attest to the benefits of early care for vulnerable children in the age group that we are sponsoring today. Research has shown time and time again that infants who receive high-quality child care and early education programs do better in schools, have more developed social skills, and develop fewer behavioral problems. Words of Judy Bigot. And now, I invite the Honorable Minister of Social Development and Education, Ms. Deanne Kentish-Rogers, to give her brief remarks. Welcome, Ms. Kentish-Rogers.
Good morning, everyone. It's a pleasure to be here this morning and to be among all these beautiful babies. So if you hear some of them gurgling in the background, please don't be alarmed. That's normal. If you have a child, you should know. I haven't had one yet, but my entire cabinet is pressuring me insistently. I'm witnessing it firsthand with my ministerial assistant, Mrs. Gums Marie, and you know, I am here to be a very good auntie. This morning, we're here to celebrate a very important initiative as a second pillar to our very successful Senior Shield program, and it's called Junior Shield. As our Premier has repeatedly reminded us, our key focus has been to focus on how we treat the most vulnerable in our society, the very old and the very young. From first starts to free health care for persons under the age of 6. This initiative not only builds on the support we provide to families at the beginning of a child's life, but of course, encourages our people to grow our population. And I want this morning to speak to the data, the science that supports these decisions. It is proven that early intervention in terms of healthcare allows for early diagnosis, treatment of health issues, which can prevent more severe outcomes and conditions later on in life. A study by the World Health Organization highlights that investment in child healthcare leads to reduced child mortality and morbidity rates. The US and Medicaid program has shown that children with access to preventative care also have lower hospitalization rates. Immunization and preventative care also contribute to better immunity and better population health. So I'll turn now to the economic benefits. One, for parents, the reduced cost of healthcare access for parents leads to more disposable income in the pockets of our parents. And I want to speak to one young man who 2 weeks ago asked about the government of Anguilla's launch of Senior Shield and said that he's starting a new business. And of course, his priority is still his children. And so it is a major, major relief for him not to have to consider where he's going to get the money from to take care of his child during these years. In relation to long-term health care, early health care reduces the need for expensive treatments later by preventing chronic conditions and dealing with chronic conditions like asthma, diabetes, and malnutrition. It is also very well known that parents are less likely, parents of course have to attend to the needs of their children as a first priority. Many parents miss work due to their children's illnesses and their limited access to affordable health care. This initiative will improve family income stability and contribute to higher economic productivity. I'd like to turn to the social benefits. In relation to Junior Shield, it is proven that early intervention in healthcare programs allow children to engage more fully in school and community-based activities, fostering stronger social cohesion. It reduces parental stress related to healthcare affordability, leading to better mental health for parents and stronger family dynamics. And in relation to education, healthy children are more likely to perform better academically, increasing their job opportunities later in life and their access to higher paying jobs. The World Health Organization estimates that every $1 spent in early childhood healthcare yields $7 in societal benefits, including healthcare savings and economic benefits. If you look across the region, Jamaica's free healthcare program for children has yielded a 45% increase in pediatric clinic visits within the 3 years of its implementation. They've reduced infant mortality from 23% to 14.7%. And families have reported saving up to 30% of household income on healthcare costs, redirecting those funds to education and other needs. We now, in Anguilla, join the ranks of our brothers and sisters across the region in this program. And I want to thank the Honorable Premier and the Ministry of Health and the Department of Health Services for their activity and their foresight in ensuring that this program came to fruition. Thank you very much, and I look forward to joining the program sometime in the distant future.
Thank you, Minister Deanne, for connecting the dots and highlighting the importance and impact that this Junior Shield program would have on our youths and the social and economic impact as well. So before I invite the next presenter, I will share with you a bit about the Junior Shield 0 to 5 program, who is eligible and what is covered. Of course, we have already established that we are covering all children under the age of 6 years old, children residency status. It will also cover children who are born in Anguilla or children whose parents, guardians are resident on Anguilla as well. What will this program cover? The following healthcare services would be provided at the Government of Anguilla healthcare facilities. Coverage would include the outpatient services, physician consultations, pediatric visits, for inpatient services, admissions, surgical care, emergency and other medical services, including accident and emergency care, medications prescribed by the government healthcare providers, diagnostic tests as well. What is not covered, which is important to note as well, costs incurred prior to the launch of the program. We are launching today, January 20th, so any costs incurred before would not be covered. From here onwards, yes, until age 6, children, you are covered. What else is not covered under this program? Services outside the government health system. So healthcare services that would be obtained to private practitioners would not be covered under this program, be it locally or overseas. It will not be covered under this program. So now I would walk you through what would make you eligible and what you need to present to the Minister of Health. So the application forms, of course, you would have to complete that form, and to submit with that form, you would need to present your child's birth certificate, the child's health record that was issued in Anguilla, and for the parent or guardian, you would need also to provide proof of identification. We are accepting your passport, your Anguilla electoral ID card, or your social security card. So if applicable, we would be requiring proof of residency, and you can use your work permit, your residence stamp, or your belonger certificate. That would work as well. For further information regarding this program, please feel free to call the ministry at 497-3930. Just to note as well that the application forms would be available after the launch this morning, and also we would be placing forms at outlets at the Princess Alexandra Hospital, at the polyclinics. We would also post application forms at the preschools as well, and you can also obtain them at the Ministry of Health. Any questions, you can speak with myself or members of my team, who you would see shortly after this morning proceedings. So moving along into our program, it was said that the health of the child is the power of the nation. The health of the child is the power of the nation. And I'm sure you have heard that repeated before in the presentations that went by. Our next speaker is not just a minister of government, but also a medical doctor, one who is passionate about improving healthcare services and delivery on Anguilla, making it easily accessible and affordable to all. He is one who truly understands the importance and benefits of investing in quality health care, especially at the earliest stage. As the saying goes, prevention is better than cure. Please help me welcome the Honorable Premier and Minister of Finance and Health, MD Ellis Lorenzo Webster, to give the address and to declare this program officially open. Dr. Webster.
Adopting the established protocol, I'd like to say good morning to all and welcome. It's certainly would like to recognize the Acting Director of Medical Services, Dr. Wanda John, the Chief Medical Officer, Dr. Aisha Andrew, and also the Director of Nursing Services, Nurse Alicia Harewood, the director of the chronic disease unit, Ms. Twyla Bradshaw Richardson. And it just shows the buy-in from the health professionals that we have here in our midst, doctors, including Dr. Indira Singh Bachelor, who is our resident pediatrician. And I'm sure she's happy to know that help will soon be coming. And also the nurses who are present. Fala, I see you hiding back there. It was good to spend time with you in the OR yesterday. You know what is good about this program is that prior to us coming into office and during the campaign of 2020, the representative for District 3, or the candidate, Mr. Courtney Morton, he would constantly insist that we have to put in place free medical services especially for the elderly. And he said, like a Medicare system in the U.S. Courtney having spent some time in St. Thomas as a bank manager. And then he came in as ministerial assistant in the Ministry of Finance, and he continued to advocate. And we were told we had to get do the necessary studies to make sure it could be afforded. And when we took it to Executive Council, we were turned back several times because the actuarial studies were not done at the time, and when they were done, we didn't have the funding to do it because you cannot take any unfunded policies to Executive Council. Executive Council is where you meet the governor, deputy governor, attorney general, the financial advisor, and then the ministers. And so we were finally able to get through with Senior Shield. And Senior Shield covers Anguillians 70 years and older. And we were catering for about 730 persons. And right now we're over 1,100 persons who are registered for Senior Shield. And then we know that the vision of the Anguilla Progressive Movement Administration was to build a great society by investing more in people. And this includes improving the quality of and access to health care. All great societies are judged by the way they take care of the vulnerable, the elderly, and the very young. Junior Shield is to make sure that we cover those who are less than 6 years old, because as you've heard, those are the years that are most important. That is where we make sure that young minds are healthy, bodies stay strong for growing up, and for the potential that they provide to us, the people of Anguilla, and to the world, because who knows, sitting in our midst may be the person that will cure cancer. Maybe the next Premier of Anguilla. Maybe someone that will take us to Mars. And we know that Noelle will be the next actress representing Anguilla, as you can see how well she did on the video. We also will be covering patients with dialysis and with certain disabilities also as part of these programs, because we do feel that it is important to provide access to health care. Governments are of the people, by the people, and for the people. And we do better when we can do better. That requires that we have to have the resources. So as resources increase, the benefits increase. And you have seen that with this administration, with electricity credits, food vouchers for the elderly, increased assistance to needy families. But also in the private sector, we've seen first starts put out by GLH Productions, where the babies are born, they get a box that contains the necessities for babies. And there's no discrimination. You don't have to qualify. You don't have to be of a certain, socioeconomic standard. Everyone qualifies for these benefits. And that's what I think is important. We don't want stigmas. We don't want discrimination. I noticed that while Minister Kentish Rogers was speaking, the room went quiet. All the babies were listening, which means that that's a good quality that she has of soothing. And so since she just had a birthday on the 13th of January, we're asking, I heard a clock ticking, we're asking that, she get a move on, because we do want to see, the birth rate increase in Anguilla. But it is programs like these, though, that, that make it necessary, that benefit all of us. And it doesn't benefit only the children under 6 or those 70 and older. It benefits the families of those, the parents of those, because as someone said, what you don't have to pay in healthcare, that is money in your pocket. The persons who told us with Senior Shield that their family member was in the hospital and there was a bill for $80,000, and when they went to pay, they showed the Senior Shield card and it was zero. It brought tears to their eyes. I'm sure now that you parents, when you go to the polyclinics and the Princess Alexandra Hospital, when you register, sign up, get your card, and when you see that your bill is zero, you too will be happy for that. And that's what it's about. And the services that I heard Nurse Faye read out, and also encouraging you to show up, that's important. Because if we provide the service, you should access it. It's no good that the service is there, accessible, free, and you don't access it. And I know Dr. Singh, Bachelor, is cringing back there because she knows the number of patients coming is increasing. But as I said earlier, we are providing pediatric help for you, and also we are recruiting for permanent pediatrics, along with other services. So I just want to say that I am happy that to launch this program. There are some children that have already been registered since last week, and they will get their cards today. And I know the permanent secretary will have those names available. But also encouraging those of you who are here today to apply, and the applications will be provided so you can apply today. I am going to now happily, and I know that Mr. Courtney Morton, he continues to be happy, and I know all the ministers, parliamentary secretary. No new babies for you for a sec. Grandbabies coming though. We are happy to launch this program today, and certainly hope that you'll take advantage of it. And know that this administration continues to care about people, continues to care about you. And we look forward to assisting in any way we can to make it easier for you to survive and thrive in this beautiful paradise of ours. Thank you. May God bless you. May God continue to bless Anguilla.
Thank you, Premier, for sharing your vision for healthcare and Anguilla in that short address. You summed it up real nicely. I am sure we all will agree that children deserve to be happy, you hear them here in the background, healthy as well, and safe. So Premier would have indicated that we do have the cards, and we know we are dealing with children, and you understand how excited and happy they are to get out of this space that we have them in. So we're going to move quickly as we come to the end of this launch. I want to invite Minister of Health to come forward, and he will be supported by Program Officer Ms. Lavelle Niles. to distribute the Junior Shield cards. We're only going to distribute right now the first 5 children who registered for the program. So we're going to give them a big hand. So for those children who registered, I'll have to call it up first. For those children who registered during the first 3 days, that is Monday, January 13th to Wednesday, January 15th, we do have those cards ready for you as well. You can collect them right after the ceremony. And for those persons who would have registered after, we should have those ready for you by the end of this week, once we get our printing completed. So without any further ado, I will be calling the names of our first 5 registered children in the Junior Shield program. I'm going to try to call the names because, you know, pronunciation of names could be very well an exam, but I'll do my best. So we have Abdias Pimentel Sanchez. Do we have Abdias Pimentel Sanchez in the room? Mommy, you can come forward as well, please. Nice. Thank you, Baby Sanchez and parent. Yes, good job. Here you go. Next we have Royden Fabian. Royden Fabian, come forward, parent. Thank you to the parent and baby Fabian for registering. Congratulations. Levio Fanas. Levio Fanas. Levio Fanas. And we also have Livon Fanas. So we have 2 present with us. Congratulations, baby Fanas, the 2 of you. And last but by no means the least, we have, is this Cyan? Cyan George, do I have it right? Sarayan George, okay. There you go, oh, that's him. Oh, it's Rihanna, Sarayan. Congratulations. Thank you, Premier. And we will now quickly move into the vote of thanks. As we bring this ceremony to a close, I have the pleasure of recognizing those who made this lunch a great success. I'm sure you all would agree that we had a wonderful morning here this morning. Let me hear a round of applause for that. We sure did. The Honorable Premier, Minister of Finance and Health, I want to thank you for your vision for healthcare on Anguilla, for making the finances available to support this program, for your informative address and distribution of the cards to the first 5 children who registered for the Junior Shield program, 0 to 5. Thank you, Premier. Thanks as well to Minister Deanne Kentish-Rogers, our Minister of Social Development and Education, for sharing the vision as well on improving child health care outcomes on Anguilla. To all other honorable ministers of government and ministerial appointees and associates for gracing us with your presence in support of this initiative. Apostle Denroy Gums, thank you for your word of prayer. Thank you to the other presenters who shared in this ceremony. Health Services Commissioner, Ms. Leanne Salande, for assuring us of the readiness of our medical facilities to undertake the demands of this new program. I can imagine the rush we will have, but we are ready and committed to serve you. Public Health Nurse, Ms. Faye Astafan, thank you again, Ms. Nasfe, for a dynamic presentation on the services and care that are available at our facilities for our children. Thank you, Nas. Parent Rihanna Stott, for that touching and inspiring presentation, and I hope that all parents would take full advantage of this initiative. Remember, it is free for all children under the age of 6 years old. You have no reason not to be covered. Recognizing as well the principals, staff, and parents of our preschools. We have St. Mary's Preschool present. I think I see Teacher Telmers here as well. Thank you all for getting involved and supporting the better health care for our young children. Thank you for coming out. We are grateful to the parents and children who participated in the presentation this morning as well, and to those parents who consented for their child or children to be included in the promotional materials that you're seeing being displayed on our big screen in the room. Thank you, parents. For those persons who worked tirelessly behind the scene to make this launch a success, thanks to the following persons for their administrative support: staff of the Ministry of Health and the Chronic Disease Unit, staff of DITES and the Electoral Office for setup and printing of the cards, and also to our DITES team who we have on the ground now for assisting with our technology and ensuring that we are connected and we are being covered clearly and live. To our public relations officer and his assistant for your unwavering support from the onset. Thank you, guys. We couldn't have done it without your help. In the absence, I want to thank our health planner, Ms. Rochelle Rogers, for taking the lead in coordinating the data for the study of this program and engaging our overseas consultants. And at the same time, I would like to thank Mr. Derek Osborne and team of TELUS Health in the Nassau, Bahamas, for providing the actuarial and consultancy services for the Junior Shield program. We can applaud them in their absence. It would be remiss of me not to mention the amazing work and leadership of the director of the Chronic Disease Unit, who stepped up to the task in the absence of the health planner. A warm thank you to Twyla Bradshaw Richardson. To our media houses for covering this proceeding and for promoting Junior Shield. Expressions of gratitude to our photographer. Remember, it says a picture says 1,000 words. We want to thank our photographer, Mr. Zuru Wilkes, for performing the duties of creating those memories. Thank you, Mr. Wilkes. And last but by no means least, to you, our invited guests, who came out in support of this initiative, and those who participated via media houses, a warm thank you as well. Once again, spread the word. We encourage all parents to register your children who are between the ages 0 to 5. Remember, it is free. No reason not to be registered. And your child's coverage will not expire until they turn the age of 6 years old. So you are covered. Thank you. Thank you to everyone. And do have a pleasant day. But before you leave, we have some refreshments available for you to take part of, so you can help yourself to that as we bring this official launch to a close. Thank you all. Before you leave, just to say, those persons who want to register now, and if you have all of your documentation present, you can join us on the side. In the back room, we will have all our facilities here set up to take copies of your documents and to get you up and running registered. Thank you all.